In this video, I want to go over the precautions and contraindications for therapeutic ultrasound. First, we need to define what we mean by precautions and contraindications. Precautions are kind of like a stop sign. If you approach a stop sign, you are going to come to a complete stop, look both directions, and decide whether it is safe to proceed. If you do choose to proceed, you might make some adjustments or be careful as you do so depending on the situation. Similarly, if you are doing ultrasound on a person and they have a precaution, you will consider the situation. You might decide to proceed with caution, and you might make adjustments to compensate for the situation. On the other hand, you might decide not to do ultrasound at all. Contraindications are like a do not enter sign. If you come to a do not enter sign, you simply don't go down that road. So if you have a client that has a contraindication to therapeutic ultrasound, you are not going to use therapeutic ultrasound under those conditions. So let's first look at the precautions for therapeutic ultrasound. One precaution is acute inflammation. The idea here is that if you are putting energy or heat into an area that is currently in acute inflammation, you might make the inflammation worse. You want to avoid high-dose ultrasound over healing fractures because it may slow fracture healing. However, low-dose or low-intensity pulsed ultrasound can facilitate fracture healing. You want to avoid high-dose ultrasound over breast implants because you could cause excessive heating of the contents of the breast implant and rupture it. That would be bad. You also want to dose conservatively if you're using therapeutic ultrasound after another thermal modality because of the cumulative heating effect. Remember, ultrasound is a conversion modality. Basically, you're just pouring energy into the tissues where that energy is then converted to heat. Ultrasound doesn't care what temperature the tissues start at, they'll just make it hotter. So that's why you want to be very careful if you're using it after another thermal modality. The caveat to that is that superficial heat tends to heat tissue differently than ultrasound does. A final precaution, and this one is really my opinion, is that you want to be really careful if you're going to apply ultrasound over a main peripheral nerve branch. My concern here is that if you dose incorrectly and you cause tissue damage, you've created a really big problem if the tissue that you have damaged is a main peripheral nerve branch. Now on to the contraindications. Remember, these are the situations in which you simply will not use ultrasound. If your client has a cognitive or communication impairment, so they can't tell you what it's feeling like, that would be a contraindication. Similarly, if they have impaired pain or temperature sensation, so they can't tell if it's overheating, you would not use therapeutic ultrasound. If the client has reduced circulation in the area where you want to apply the therapeutic ultrasound, that would also be a contraindication. The reduced circulation will lead to a reduced homeostatic effect. The body won't be able to cool as efficiently and might lead to overheating as a result. You do not want to apply ultrasound after a cold pack or ice massage, again, due to that altered sensation. The impaired pain sensation, as you remember, is a contraindication in and of itself. Additionally, pre-icing would greatly reduce the thermal effect of ultrasound, so there's really no reason to do that. You do not want to apply therapeutic ultrasound over the stellate or cervical ganglia. Do not apply therapeutic ultrasound over an area where there is active bleeding or infection. And do not apply ultrasound over a malignancy, unless ultrasound is for hypothermic treatment of that malignancy, but that's not something that physical therapists or occupational therapists would do. With malignancy, it's a little hard because if somebody had cancer in the past, you honestly don't know if they have metastases or a recurrence. So you'd be really careful with that one unless you're sure that they are in remission and they have no malignancy. Here's some more contraindications. Do not apply therapeutic ultrasound over an area where there is a deep venous thrombosis or thrombophlebitis, because if you apply ultrasound there, you might loosen a blood clot, and if that blood clot then travels to another area of the body, it could create an infarct there, perhaps in the lungs, heart, or brain. That would be a really bad thing. Do not apply therapeutic ultrasound over a pacemaker, implanted defibrillator, or any other implanted electrical device, as it could interfere with the function of that. Do not apply ultrasound over central nervous system tissue. Now, central nervous system tissue, in most cases and in most people, is covered by bone, so we don't really have to worry about that. However, if somebody had a laminectomy such that there is kind of a little opening or window through which the ultrasound could penetrate to the spinal cord, you would not apply ultrasound in that area. Do not apply therapeutic ultrasound over the eye. Same reason as you wouldn't apply it over the breast implant. You don't want to heat up the fluid inside of the eye. That would be bad. Do not apply ultrasound over a pregnant uterus or potentially pregnant uterus. So in that case, you would avoid over the low back, pelvis, abdomen. And just a word about a potentially pregnant uterus, you really would need to ask your client, is there any chance that you might be pregnant? Do not apply over the testes or female reproductive organs. And that concludes the contraindications for therapeutic ultrasound. Now I want to talk about a couple of areas where there's less agreement about the precautions and contraindications, or there's some discussion anyway. So on this slide, we're going to talk about joint implants or hardware. Cameron and Bellinger both say that ultrasound or therapeutic ultrasound would be contraindicated over any plastic joint implants and any joint cement. Kahanoff, Prentice, and Draper say therapeutic ultrasound is contraindicated over joint cement. Plastics and bone cement are a precaution, according to Lake and Bellew. Bracciano says that the use of therapeutic ultrasound is okay over plastic and joint cement as long as the sound head is kept moving. So you can see the range of opinion here. It seems that at least 3 of the 5 textbooks say it's contraindicated, certainly over joint cement, and 2 of the 5 say contraindicated over plastic as well. So I would tend to just not do it in that situation. Interestingly, ultrasound over any metal hardware is fine as long as you use appropriate technique and pain or discomfort is avoided, like you always would. So all 5 of the textbooks say that it's fine to use ultrasound over metal plates, screws, that sort of thing. Another area where there's some disagreement or discussion, I guess, would be epiphyseal areas or growth plates in children who are not yet skeletally mature. According to Lake and Bellew, therapeutic ultrasound is simply contraindicated over growth plates. According to Cameron, we want to avoid high-dose ultrasound, and Cameron defines high dose for this particular situation as greater than 0.5 watts per square centimeter, but didn't specify the frequency, which of course has a big effect on the heating effect. Kahanoff, Prentice and Draper say do not use ultrasound at high intensity, and they define it as over 1 watt per square centimeter. Again, not specifying the frequency. Bracciano says avoid higher intensities if possible, and Bellinger just calls it a precaution. So you kind of have the whole spectrum here. Again, given the at least one author calls it a contraindication, and given the risk, I would just not do therapeutic ultrasound over growth plates in children who are not yet skeletally mature. There's always another way to accomplish what you want to accomplish, and so why take the risk? And here are the references for the 5 textbooks and 1 peer-reviewed article that I used to compile these precautions and contraindications.